Hello my dear students, today we are going to discuss how we will do pelvis AP view. So in case of pelvis AP view, the patient will lie down in supine position perpendicular to MSP. Next you are going to select the size of cassette. The cassette size will be 14 into 17 and it will be placed longitudinally. You are not going to place the cassette below the patient, you are going to place it in bucky and you are going to select the upper limit 2 inch above the iliac crest and the lower limit will be 1/3 of the femur. Next you can see here the area of interest is coming at your side, so you have to remove this from the field of view, so that is called as our FOV. You can keep the hands on the chest level or you can ask them to raise it over the head. Next thing is you have to decide whether you are going to take inlet view, so the feet will be turned 15-degree medially like this in the image. If you want to take outlet view, your feet will be placed outward and this is the position for neutral view, where both the legs will be kept together without any kind of rotation. Next thing is we are going to decide the centering level. So the centering level will be, you can see here, this is the iliac crest. Just below the iliac crest will be midpoint between the ASIS, that is anterior superior iliac spine, or superior border of pubic symphysis. Next thing is the position of the tube. So while you are positioning the tube, it should not have any kind of angulations. The beam should be vertical. So you can see here, and we are going to select an SID of 100 centimeter. So this is how you select the centering point. So see now the patient is positioned. Next thing is after completion of the position, you have to select the KVMA. So you have to move to the control panel. You can see here we are going to select a KV of 96 and MAS of 80. But it will vary depending on your patient, whether it is a pediatric patient or an adult patient or healthy patient. So that was all about the pelvis AP. This is the image of pelvis AP. Now the main thing which I always say you is that if you are taking pelvis neutral view, this is not taken in the department because this view fails to show was the head of the femur clearly. So this will show you only the oblique region of the femoral neck. So this view is not taken in the department unless and until if necessary. But so always we are going to take the pelvis inlet view. So you can see here, this is the pelvis inlet view. The main purpose of this view is head of the femur, neck is seen clearly, and you can rule out any kind of intertrochanteric fractures very much clearly in the pelvic inlet view. And this view we will be doing to all the patients who are coming to the department, but you should be cautious if you are having trauma patient. Then you are going to put additional support with the help of foam pad. Next, the third image you can see here, this is the outlet view of pelvis. So this view you can see, I have mentioned you with the red marking. This view is mainly that in this view the specialty is we can see the lesser trochanter. You can see in the rest two views like neutral and inlet, you can't see the lesser trochanter clearly. So this is the most favorite view for our orthopedic technicians who are undergoing the surgery for pelvic examination like THR. So this view is mainly taken in OT area to see the lesser trochanter clearly. So again I am saying pelvis neutral view for oblique portion of the femoral neck, inlet view expandable of femoral head and neck area, you can see it very clearly. And if you want to see the lesser trochanter, you have to go for the pelvic outlet view. So this video is mainly for your education purpose. Please don't share it in social media.